Hi, this is Dr. Hobbs. So we've begun this journey together to restore your health. And I know you have a lot of questions, and many questions you should ask that you don't even know to ask yet. So you should have this form here, this expectations and agreements. And this is going to be part of answering a lot of those questions and getting you started on the journey correctly and our relationship started well. All right, so we're just going to walk right through this. So look at this page as we go through it. So how should you feel? This is the short-term expectations. We've probably talked about this a little bit, but it's reconnected. You should feel reconnected between your brain and your body. You may feel better, you may feel the same, you may feel worse, but you should feel you've noticed a reconnection, and that's good. And that's when the healing begins. So because we're not using dangerous drugs and we're not suppressing symptoms, we're working with the body to help it heal naturally, and this is what happens. So the problem's not gone, the problem has just begun to heal, so you might still notice it's there. All right, next, what can you expect from us? Each time you come in, you expect an expert analysis and effective adjustments. All right, that's why we're here. Once your condition is well analyzed, reanalysis and treatment only really takes 3 or 4 minutes. So I may do some muscle work during that time, and that'll take longer. And my best work comes when I'm focused, right? I want to focus on your adjustment, and the next patient, I want to focus on their adjustment. So consultation, that's not a time for consultations. We can schedule consultation. You can talk to Anna. We can talk later that evening. We'll give you a call, or we can schedule a time where we can sit down together and have a little longer discussion if you need it. But the time where we're adjusting, I need to be focused on treating you and analyzing you well. Always educating, that's number 2. So right down here. So always educating. I should be teaching you something new almost every time you come in, or remind you of something new. Repetition is great. So I want to give you clear information. Really, the goal is to information for your health to guide you along excellent health trajectory. So what is that? What does it mean by trajectory, right? So that's a direction we're heading. So a lot of people are heading toward sickness and disease. We want you heading toward health. You're going one way or the other. And yeah, there's a lot to say there, but that's a good start. The adjustment room, we think of that as an adjustatorium, kind of like an auditorium, but it's an adjustatorium. So it's adjustment and it's education. So I've got the responsibility of providing you continuing education, right? I get continuing education every year to become a more and more knowledgeable, make sure I'm staying up on things so that I can be the best at serving my patients. And you need to be continuing to be educated as well, so you can continue to serve your own health. And so that's a service we provide you, and that's part of what you pay us for. All right, and so Anna will be part of that too. She's going to be encouraging you in education, so we can expect that everywhere you turn, you're going to be learning more, and I hope that is a wonderful experience for you. And number 3 is on time. We have specific scheduled time for you, and we work hard to stick to that. All right, next, midterm expectations. What should you do? You should learn and apply. So first, it's a partnership. So we don't do this to you, we do this with you. And there's a 3-legged stool that helps accomplish that. So we see this picture here. So this 2-legged stool, it doesn't work well that way, all right? People get by, this person on that stool is balancing, but it's not, and that's what happens with a lot of people these days. They're like, oh, I'm fine, until something comes along and takes their health away from them. It's like, oh, I guess I was just alive, I wasn't really healthy. So there's an appointment rhythm. We came up with this schedule for you that's specific. Regular adjustments, appointment times are scheduled for treatment, education, and accountability. Number 2, break bad habits, which you eat, drink, breathe, think, sleep, and move, relates to trauma, toxicity, and thought. These are the things that can either contribute to our demise or to our improvement. And so again, we'll be educating about those things. We'll have videos that we'll share with you, handouts we'll share with you, and more. And next, perform home supportive care. Again, we'll be assigning specific exercises for you and your recovery, and it's important that you do those as we partner together for your health. And third, overall, is required attendance at the Better Results Faster Workshop. This is where we answer a lot of questions that we can't answer in this video or other shorter time frames. So we'll be providing that information to you in different formats so that it's convenient and it's effective and it is necessary. All right, long-term expectations. What will that accomplish? So better health trajectory. We talk about health span versus a lifespan. We don't know how long we're going to live, but as long as we're alive, we'd like to be. As long as we're alive, we'd like to be living, right? So you have a purpose, and you want to be accomplishing that as long as you're alive. So healing continues. The adjustment allows the healing to begin. The adjustment is not a healing, but it restores that nerve communication. Over time, there's more nerve and brain coordination of the body, blood flow, muscle tension, relaxation, and organ function. So the body does the healing in between visits. And that's why it's important that you support it in what you do. So the longer you're healthy, the healthier you can become. There's a lot in that statement, and I'll share a video with you that we have a video on that can be really insightful. But think of an orange tree. The longer you keep that healthy, the more fruit and the better fruit it's going to provide each year. All right? Healthy is our natural design, our normal design. We're being taught that health is not normal, that disease is normal, and taking medications is normal. And it has become normal. This is what people do. You know, you get to 50, if you don't have high blood pressure, heart disease, diabetes, cancer, then you consider yourself lucky. That's not the way we're designed to be, and that's not the way it has to be. And you have influence. Your behavior matters. Your health is your choice. And by choosing well, you can change your health trajectory for you and for your family. And you have chosen well. You're here. You've begun this. So I congratulate you, and you should feel good about that. We commit to being there to help you reach your health goals and what that allows you to do and who that allows you to be. Thanks, and we'll talk to you soon.